Hi, I'm Wendy Alexander, a pediatric occupational therapist with over 25 years of experience. The next cohort of Pediatric Feeding Essentials starts in 10 days, March 4th. And before enrollment closes, I wanted to share with you why I created this course and why it's different from other feeding trainings out there. Here's the thing. I've taken several really good feeding courses over the years. Courses on sensory processing and feeding, courses on oral motor skills, courses on behavioral approaches, and they were all very valuable. But here's what I noticed. Most feeding courses go deep in one specific area. You take a course on sensory processing, then you realize you need more trainings on medical complexity, so you take another course. Then ARFID becomes a thing, so you take another course on that. And then you hear about responsive feeding and realize that the behavioral approaches that you learned are outdated, and so you take another course. Before you know it, you've spent thousands of dollars and countless hours trying to piece together a comprehensive understanding of pediatric feeding. And even after all of that, you still feel unprepared when a complex case lands on your desk. That was my experience. I had taken multiple feeding courses, I had years of clinical experience, I completed my doctorate with a capstone project specifically on pediatric feeding disorders, and I still felt unprepared when I encountered tube feeding and tube weaning readiness, ARFID, which is a relatively newer diagnostic category, responsive feeding approaches as the field has shifted away from compliance-based and behavioral methods, trauma-informed care related to medical, trauma, and psychosocial history, the nuances of feeding in the context of neurodiversity. And these weren't edge cases. These were the kids I was actually seeing. And here's what really struck me. After 13 years of qualifying kids for early intervention services through ChildFind, I realized that OTs and SLPs are almost always the first therapists assigned to kids with delays in adaptive skills, which includes feeding. We're the ones we're getting the referrals. We're the ones families are counting on. But when therapists get these cases, there's no clear guidance, no comprehensive training, no ongoing support. They're just expected to figure it out. And that's not okay, because feeding is one of the most complex areas of pediatric practice. It's not just oral motor skills, it's not just sensory processing, it's not just behavior. It's medical complexity, it's developmental readiness, it's sensory integration, it's interoceptive awareness, it's parent-child relationships, it's trauma history, it's neurodiversity considerations. All of these pieces interact with each other. You can't treat feeding in a silo. But that's how most of us were trained, in silos. So I wanted to create something different. I wanted to build a course that didn't just go deep in one area, but gave therapists a comprehensive foundation across all the essential areas of pediatric feeding. Not surface level overviews, real, clinically applicable knowledge that you can use immediately. So here's what Pediatric Feeding Essential covers over the 11 weeks. Week 1, Foundations of Pediatric Feeding Disorder. We start with the big picture. What is a feeding disorder? How do we define it? And what framework should guide our thinking? Week 2, Medical considerations, reflux, aspiration risk, failure to thrive, GI issues, the medical complexity you need to understand to keep kids safe. Week 3, feeding skill development, the developmental progression of feeding skills and how to support skill building. Week 4, feeding readiness, how do you know when a child is ready for solids, for cup drinking, for self-feeding? What are the actual readiness signs? Week 5, sensory processing and interoception. This is where sensory processing meets internal body awareness and how both drive feeding outcomes. Week 6, oral motor skills. Evidence-based oral motor assessments and interventions, not outdated exercises, but functional feeding skills. Week 7, responsive feeding and behavior. The shift from compliance-based feeding to responsive feeding. What is it, why it matters, and how to implement it. Week 8, trauma-informed care and ARFID. understanding feeding in the context of medical trauma and psychosocial trauma, plus how to recognize and support ARFID. Week 9, tube feeding and transitions, tube weaning, supporting oral feeding alongside tube feeding, and navigating the medical team. Week 10, neurodiversity and feeding, feeding in the context of autism, ADHD, and other neurodevelopmental differences, and how do we modify our approaches. Week 11, goal writing, clinical reasoning, and collaboration, putting it all together, writing meaningful goals, knowing when to refer out, and building your team. But here's what makes this course different from just watching a bunch of recorded sessions. Every week, we meet live for 1 hour. I teach the content, and then we apply it to real cases. You take what you learned that week, try it with your actual patients, and come back the following week with questions. Examples: I tried responsive feeding with my family, and the parent gave a lot of pushback. How do I handle that? Or, I have a tube-fed child who's medically cleared, but the family is terrified. Where do I start? Or, the child has extreme selectivity. Is this ARFID or sensory-based feeding disorder? That's where real learning happens. Not just knowing the theory, but working through it in real time with support. I also wanted to make sure this course reflects current evidence-based practice. That's why we discuss assessment approaches guided by Feeding Matters, the feeding consortium that's been instrumental in establishing the pediatric feeding disorder diagnosis and advancing the field. This isn't information from 10 years ago. This is what's happening in pediatric feeding right now. So, who is this course for? It's for OTs and SLPs who feel uncertain when they get feeding cases, have taken some feeding courses but still feel like pieces are missing, want to understand the why behind feeding behaviors, not just the strategies, or are tired of Googling during sessions, or want to feel confident assessing, treating, and knowing when to refer out. Whether you're brand new to feeding or you've been doing it for years, this course gives you the comprehensive foundation to walk into any feeding case with confidence. Here are the details. Starts March 4th, 2026. It's 11-week sessions, Wednesdays from 5 to 6 p.m. Mountain Standard Time. It's 12 AOTA-approved continuing ed hours for $360. Sessions are recorded, so if you miss one, you won't fall behind, and you'll get assessment tools, treatment protocols, handouts, and then lifetime access for all materials. And you'll be part of a community of therapists who are working together to grow their feeding skills. So if you've been thinking about joining, now is the time. We start in 10 days and spots are limited. This is the course I wish I had when I was starting out in feeding. And honestly, the course I wish I'd had even after years of experience. If you're ready to stop feeling unprepared and start feeling confident, I'd love to have you join us. The link is in the description below. Thanks for watching, and I hope to see you in March.